Good afternoon, everyone. I'll welcome you to the September 28th meeting of the Rotary Club of Gainesville. We're so glad to have all of you here and all of you who are on Zoom with us today. And guests and visiting Rotarians, if you're joining us virtually on Zoom, please identify yourself in the chat. And if you're watching on YouTube, please register your participation by sending an email to info@rotarygainesville.org. And without further ado, we're going to have a song from Pete Inwall.
I noticed that Melanie did not say we're going to have a joke, so that's some judgment on my jokes. Did you ever, have that feeling when somebody walks into your life and you didn't expect it, and your heart starts to flutter, and your knees get a little sort of weak, and you just feel good all over, and those people are called police officers. Don't yield to them. All right, we're going to sing America the Beautiful today. And I'll try to hit the high note. Oh, beautiful for spacious skies, for amber waves of grain, for purple mountain majesties above the fruited plain. America, America, God shed His grace on thee, and crown thy good with brotherhood from sea to shining sea. Please join me in pledging allegiance to our flag. I pledge allegiance to the flag of the United States of America, to the republic which stands one nation under God, indivisible, with liberty and justice for all.
Thank you very much, Pete. And we have an invocation today on Zoom from Kevin Thorpe.
May we pray. Lord, we are eternally grateful for this day. Thank you for all that this day means and all that it will contain. Thank you for this privilege of allowing us to assemble together, both in person and through the online audience. Continue to bless the works of our hands and the words of our mouths. We are honored by today's presentation. We pray your blessings upon Dr. Slaton and the North Florida Regional Medical Center family. It is for your sake and for your glory we pray. Amen.
Thank you so much, Kevin. You may be seated. At this time, though, we'd like to have introduction of any guests, visiting Rotarians, Rotarians with guests.
Good afternoon, fellow Rotarians and guests. I am honored, privileged to introduce two guests that I have today. The first one is my mother, Susan Gracie. She is attending her very first Rotary meeting. So please welcome Susan. And also I have as my guest, Miss Jessica Jacome. Jessica is a close family friend and one of the most caring, just careful, unselfish, this is a special human. Please welcome Jessica.
Hi, Rotarians. I'm Richard Allen, and our guest today is a visiting Rotarian from King City, California, Brett Saunders. And Brett is moving to this area, and I believe that we are going to have a new member in the future. So welcome, Brett.
Welcome. Okay. All right. At this time, we're going to have announcements by Rotarians. Scott Winsler, I believe you have an announcement about ethics in business.
So as chair of the Ethics and Business Award Committee, it's my excitement to let you guys know that the 2022 Ethics and Business Award process has begun. And that involves each and every one of you. As you know, this award is done in conjunction with the Greater Gainesville Chamber of Commerce and has been presented annually by this club since 2011. It's a very prestigious award. We look throughout the community for business leaders who exemplify and execute high levels of ethical standards. So this involves the club. It's not just the committee, it's everyone here. In fact, committee members on our committee cannot make nominations, but club members can. Members of the community at large can. Members of the Greater Gainesville Chamber of Commerce can make nominations. And the strength of this award is only as strong as the nominations that come forward. So I encourage everyone in assembly today on Zoom to meet with your people in your network. Think of people that you feel exemplify Rotary's standards of high ethical conduct and standards, and make a nomination. You can download the nomination form on DACDB, and also you can get one just by emailing me or any of the committee members, and I'd be happy to send you one. The process is that we will receive nominations between now and November the 5th. That's the deadline. In November, then the students, the University of Florida Ethics Ambassadors, students from the University of Business School of Warrington School of Business, will interview each of the nominees and make a recommendation. Then in December, the committee reconvenes to consider the students' recommendations, and we make our final selection as to who the winner will be. So I encourage you all to pick up a nomination form, download one, contact any member of our Ethics and Business Committee, and make a nomination. Thank you.
Thank you very much, Scott. So at this time, I'm going to turn the program over to President David Gracie.
Welcome, fellow Rotarians and guests, to our September 28th, 2021 Rotary Club of Gainesville meeting. I want to also welcome everyone joining us on Zoom. I'm still very appreciative that we have that capability. Bill Stasowitz, who we got up here, Frank Mason, Mary Kate Walker, many others, Kevin Thorpe. Kevin Thorpe, by the way, thank you for that beautiful invocation. Something I had a note to mention today is really how appreciative I am, and how I have really a keen awareness of how fortunate our club is to have that tradition, and to have the capability and just the respect for each other that we can have an invocation before each meeting. I think that's a wonderful thing, that we have such a broad group of members of the clergy from various religious denominations, and each of you does a wonderful job. Thank you, Lori Vidal, for helping Melanie get that planned each week. Something else I wanted to mention today, September 28th, I said that date very deliberately because it's a special date for me. It was 14 years ago today that my son Cecil was born, my mother's grandson. So this is I said this last week, I love this time of year. I love the sports being played, college football, the Ryder Cup this weekend. So much going on this time of year. I'll tell you that one thing that is a little bit missing from this time of year that I've traditionally enjoyed is kind of the club getting geared up for the Seafood Spectacular. As many of you know, we haven't really made the official announcement from the podium, but I know it's gotten out that the Rotary Club of Gainesville Foundation, we made what I call a prudent decision not to hold the spectacular this year. We just thought, in the setting of COVID, and whether or not someone gets sick because of us, that would be awful. But even if no one gets sick, what kind of a message are we sending to the community if we did something that might be considered reckless by doing something like that? So instead, let me get to the good news. So instead, we've got our fellowship chair, TJ Pache, along with Dwight McKee and Lisa Mueller, Matthew Brady and a host of other folks are planning what's going to be an awesome fellowship out at Hatchet Creek. It's going to be kind of along the same theme as the Seafood Spectacular. We'll have some great food, some nice spirits if you like that. And most of all, we'll have that awesome, beautiful setting out at the Hatchet Creek. It's going to be a kind of a more intimate deal though. So it's just going to be our club. It's going to be a club fellowship. So I'm really looking forward to that. This is just a little preview I'm giving. We're in the midst of planning it. So just look forward to that. I tell you, I'm not going to spend any more time up here. We've got a wonderful program today, and just judging by this being a full room, I know Dr. Robert Slaton is a friend to many, and he's also a physician to many. So I'm going to invite Miss Susan Crowley to come up and please give Dr. Slaton an introduction.
Our speaker today is Dr. Robert Slaton, who's a senior member of Gainesville Internal Medicine Physicians. And I've already also realized he's a real crowd favorite today. He had a lot of visitors while he was eating his lunch. A native of West Palm Beach, Florida, he attended Davidson College for his bachelor's degree, then returned to the University of Florida for medical school, internship, and residency in internal medicine, followed by a fellowship in endocrinology. After serving 2 years in the Army, he returned to private practice where he joined the Gainesville Medical Group, Andrews and Associates. And in 2003, he became part of the Gainesville Internal Medicine Physicians. He's an active member of the medical staff of North Florida Regional Medical Center and is board certified in internal medicine. Special areas of expertise include endocrinology, particularly the primary care of diabetes, and geriatrics. Dr. Slaton is a husband, a father, and a grandfather, and when not in the office, he's either on the golf course or singing karaoke. Because of his love for his profession, he has no plans to retire in the near future. Dr. Slaton.
Susan, thank you very much. Susan and I serve on the board out at the village, and we've gotten to know each other. David, thank you. David called me about a month ago and asked me if I would say a few words about my experiences as I'm coming up on my 50th year of practice. And I, of course, said, sure. And David, I want to tell the membership, as I go through my professional years, I have only one real regret. And that is that I never accepted or pursued previous invitations to join Rotary. And I really look around at the fun y'all have, and I've been to the Wild Game Feast, and I've thought of myself as a friar. And of course, I have a lot of friends here, and it is a big regret that I did not make the time to do it. I mean, I hate to say it, we get so absorbed in our day, it's hard to carve out 2 hours during the noontime, but maybe in my retirement, if you take old men, I would love to join Rotary. Well, thank you. The title of my talk, being Medical Pearls, was a title that I gave it because I did not know what I was going to say. And traditionally, in the field of medical education, if you throw out a fact that is important and should be remembered, we have termed that a medical pearl. So what I'm going to do is run through a list of medical pearls, or at least make some medical statements about some of my observations. And then I have concocted a pilot list of guidelines on a subject that I have become very, very adamant about in the delivery of healthcare. And it has to do with the medical advocate. And I can tell you right now, if you are particularly over the age of 70 or 75, and you go into a hospital setting and you do not have an advocate, you are up the creek. And I can say that this has become more and more of a problem recently with COVID, because as you know, most of the hospitals have not until recently allowed family members into the hospital. This is all coming around again. The surge hopefully is over. And I'll get into that in just a second. And I need to watch my time because I tend to blabber and get carried away. We can go 25 minutes. Is that what you told me? Okay. All right. I was not going to say that much about COVID because all we hear about is COVID. But there are just a couple of things that I think right now I sit here and I go through as much of I've had the vaccines and the boosters and I wear the mask and I do all this. And then I had the audacity to go to both of the football games, the Alabama and the Tennessee game, where if you had to be in an atmosphere where COVID, it had to be drifting in the water vapor all over the stadium. Knock on wood, so far, we have not in the hospital seen a new surge. So I think so far, so good. I think there's one thing that I can say, the vaccine is working. This is now, as we call it, the pandemic of the unvaccinated. As best I know, at North Florida Regional Hospital, there have been plenty of admissions in people that have been vaccinated. But in people in reasonable health who have been vaccinated, no deaths, nobody in ICU, nobody has been in serious trouble. So we're all, if I go to that football game, I may get COVID, but I'm not going to die from it. And that's what is most important to me. Another topic that I was going to talk about was senior brain versus early Alzheimer's disease. This is something that comes up all the time. I'm going to go through my little antic in that everybody in this room who is over the age of 65 needs to wear a shirt with a pocket. And in that pocket, you have your ballpoint pen, you have your glasses, you have your phone, and you have your 3x5 card. And if you have these ingredients in your pocket, you're going to conquer most of the memory deficits that we have as we grow older. Just the first little pearl. People with senior brain, and I've got it. I know I've got it. We have short-term memory loss. We have slowness of thought, and we tend to succumb cognitively if we're put on overload. If we have a lot of input at one time, the phone goes off, whatever else happens, all of a sudden my brain just shuts down and I have to push everybody away and start all over again. So remember that, short-term memory, slowness of thought, and overload. I can remember a few years ago when we got into the electronic medical record, and I'm by far 15 years older than the next partner in the group, and the guy that was the instructor orienting us to the electronic medical record and computer technology, he looked out over the members of my group and he looked at me and he said, "Excuse me, sir, how old are you? And at that time I think I was 66. And he shook his head. He said, "You're never going to make it." And that sort of stuck with me, and it has been a part of my determination to get through it. But it is difficult. It is difficult for the senior brain to conquer computer technology because, above all else, you need to have short-term memory. You need to work like a dynamo, and you're constantly on overload because you're getting confused with the pop-ups and all the other things it have. Now, just to give you another little part of the pearl, early Alzheimer's disease has 3 primary cognitive impairments: short-term memory loss, slowness of thought, and overload. So the point is that senior brain, dementia, let's say of the Alzheimer's type, they both start out exactly the same way. There's the big difference is the fact that with Alzheimer's disease, it tends to be progressive. Senior brain tends to sort of sit there and meander in small circles, but does not become progressive. One thing that we unfortunately have to look forward to as we get older is by the time we're 85 or so, the person on your left or the person on your right is going to have dementia. 30% of people at age 85 tend to develop dementia. So it's just one of the things that we have to put up with. One of the things that I'm proud of in my profession, 50 years ago, when I started practicing, life expectancy for me was age 69. The average male in this country lived to age 69. Today, the average age is 78. So we've put on almost 10 years since I've been in practice. And when the Mayo Clinic looked at what have we done over this last 50 years to extend to each of us 10 extra years, it's not cancer screening. It's not really cancer chemotherapy. It's not antibiotics. It's not vaccinations. It's mainly been cardiovascular prevention and procedures. So I always tell everybody, go through all the screening for cancer and this, that, and the other thing, and do all the things you're supposed to do with immunizations, et cetera. But the real ticket to living to a ripe old age is keeping up with your cardiovascular risk factors and participating in those procedures that, let's just say, revamp your heart. One of the other topics that I was going to talk about was how to live to age 100. And this is one of my fun topics. I now have 5 patients that are in what I call my Centurion Club. They all are 100. They are thriving. They live independently. They all have a good brain. And I've tried to look at least the 5 that are in the Centurion Club right now and try to figure out, are there any messages? Are there any pearls? I talked to my poster boy last night. In fact, I was going to invite him to come, but because I was hoping he was going to be a Rotarian, and he's not, and that's Dr. Robert Lanzalotti. And I'm sure many of you know Bob Lanzalotti. He was the former dean of the College of Business. He turned 100 about four or 5 months ago. He is probably one of the most delightful 100-year-olds and he is vivacious. He has an incredible sense of humor. And so I talked to him last night. I said, Bob, can I mention your name? Oh, sure you can. You know, he's just full of himself. And he, I said, well, Bob, what can I tell the audience? He said, exercise. He says, ever since Bob Lanzalotti has been able, he has exercised. And 30 minutes of weights and whatever he likes to do in the gym. And then up until 2 years ago, it was at least 30 minutes of swimming every day. And Bob has, you know, not been without a cardiac catheterization and a stent. Bob has not been without a form of cancer. And I said, can I say anything? He said, well, Bob had prostate cancer. But it was interesting that his criteria for treatment of prostate cancer, and anybody here who's had prostate cancer knows that you have all sorts of choices. And he said, above all else, I don't want any form of therapy that makes it more difficult for me to exercise. So he chose radiation therapy, and what can I say? At age 100, he's had no recurrence of the cancer. So again, Bob Lanzalotti, yes, he has a brother who's 103, and he has a family that has extreme, incredible longevity. So picking your parents is important, but Bob is very, very much into lifestyle, and he has made it to this age 100 in fine style. The other 4 in the group are all, as I said, they live with family, they live independently. 2 of them are diabetics. 2 of them have had different forms of cancer. I think one ingredient is trying not to fall. Falling will take years off your life like nothing else when you become a senior. Now, I'm winding down to going over this sheet with y'all. Changes in primary care. And this is something that I've seen unfold in my last 25 or 30 years, and it's been disappointing to me. But at the same time, it's been understandable. When I went into private practice after my training, in my group, the old Gainesville Medical Group, and many of you remember Richard Cunningham and John Andrews and Mel Dace and Mark Barrow and Bob Thoburn. I joined the group after it had been there for about 3 years. All of us were subspecialists: cardiology, neurology, endocrinology, rheumatology, but all of us also did primary care. Well, as things have evolved over the years, if you become a specialist, you no longer want to do primary care. So most of the specialists nowadays do no primary care. Then about 25 or 30 years ago, we were working ourselves to death. We were working at Electric General. We were working out at North Florida. We were up all night. We were literally killing ourselves. And we came up with the idea of having residents and fellows from the university moonlight in our hospital and basically be in charge of admissions and handle call. And that was the beginning of the concept of the hospitalist. That concept arose in Gainesville, Florida, 25 to 30 years ago out at North Florida Regional Hospital. And then it flourished, and more hospitalists evolved all over the country. And slowly, the primary care physician sort of pushed away from the hospital. Our group basically dropped out of the hospital about 10 or 15 years ago. So I still keep up. I still go to the hospital, but I don't write orders. I don't do anything more than serve as an advisor. And it's always disturbed me that I have to look at my patient and say, if you really get sick and you really need me and you have to go to the hospital, I'm not going to be there. At least not at your bedside all the time, like say the hospitalists and the specialists. But I look at them and say, I'm going to keep up with your situation as much as possible. And then I started with this COVID thing, noticing that the people that came out of the hospital were just an absolute wreck. I mean, and I don't know if any of you have had loved ones in the hospital in the last 2 years during the COVID situation, where you had to admit them to the hospital and sort of say goodbye because you're not going to get in to the hospital until they're discharged. And heaven knows what might happen as far as communication is concerned. And then I noticed patients coming out of the hospital, I would just ask them one question. What was your doctor's name? They had no idea. What was your diagnosis? Why did you go to the hospital and what was the diagnosis? And most of the patients did not know the diagnosis. So what I've decided to do is, and this is a pilot form, and you all have copies of it, is at least help not only the patient, but help their family member understand, write down, and keep their own personal record of what is important to me as a primary care physician, particularly when you come out of the hospital. What information? Now, I'm going to get that information. And as I said, I keep up because I can use the computer to go into the hospital portal and get all the information I need. And I try to keep up with everything. But having that family advocate also participate and have the family participate. So going through this quickly, instead of, patients come out of the hospital and I say, well, why did you go into the hospital? I had a fluttering in my heart, or I had a dizzy spell. I'm encouraging patients and their advocates, go beyond the layman's diagnosis. I had atrial fibrillation. I had a TIA, a transient ischemic attack. Attach the medical diagnosis. Make that doctor or nurse or resident or whatever stop right there and give you the diagnosis. And of course, when you go into the hospital, take something to write on and write it down. When you're discharged from the hospital and they give you your medications, and this is another very, very important thing. As you know, medications have generic names and brand names. Make sure you know the generic name, the brand name, and the class of the medication. This is incredibly important when you go to looking that medication up in your pharmacy, let's just say your formulary that you're given by the insurance company. And you want to start checking the cost of these medications. There may be 5 different brands of a particular medication, and your insurance your copay may be $10 on this brand and $200 on this brand. You've got to know that, but in order to look the medication up, you've got to know the class. Perfect example, atorvastatin. Lipitor is the brand name, and that's a statin. In the formulary, it will be known as a statin. That'll be the class of the medication. One thing I like for patients to keep track of is sort of a historical accounting of success and failure. So many times patients come out of the hospital with a medication that they'd been tried on 6 months previously, and they failed on that medication. They either had side effects or medicine didn't work or whatever, too expensive. But at least compile and keep a track of your own track record of those medications that have been helpful and those that have failed. Always be sure you understand the difference between an allergic reaction to a medication and a side effect. An allergic reaction is when your tongue swells and your lip swells and you have trouble breathing and you break out in hives. A side effect is a medicine may make you nauseated or something like that. So there's a big difference. Always be aware, always at least keep a track of your medical advocates, which doesn't need to be repeated. Now, another important aspect of the medical advocate, and this, I hate to tell people this, and in fact, I hope there are no spies from North Florida here that I'm divulging some of the deficiencies, but it's in the patient's best interest. Melanie's laughing at me. She knows I'm getting in trouble. And that is I'm sure everybody knows what we mean by advanced directives, DNR, do not resuscitate, all of the things that you are asked. But oftentimes when you come into the hospital and everything is chaotic, and the second year internal medicine resident comes up to you and says, you certainly don't want to be put on a ventilator and allowed to lie there for 2 weeks. Don't you want to be DNR? And a lot of times the patient, not knowing what to do, says, sure, I want to be DNR. Well, it hasn't been explained to the patient what that really means. And it may totally change the complexion of how you're treated in the hospital. I hate to tell you that. So one of my little things that I do when I see that happening and it's inappropriate, I march right over there and get it changed. So let me just give you just one little way of simply thinking about the DNR so you can use it if you are the advocate for your spouse or your mother or your father, and this becomes important. To me, there are only 3 criteria that you have to meet, one of 3, in order to be stated that you have a DNR status, that no one is going to intubate you, put you on a ventilator, do chest compressions, that type of formality. Number 1, if you have a terminal illness, and that diagnosis, that terminal illness is made by your doctor, and your doctor is the one that tells you if you have a terminal illness. And even then, I've seen people who have been labeled as having a terminal illness. I see them 5 years later. So that you can't always be sure of that. But the majority of the time, the doctor and the circumstances are going to say the diagnosis of a terminal illness is correct. Now, the second thing, and this is important to me because I deal with a lot of patients with dementia, is what I call meaning of life. And I'm going to tell you a little story. Am I getting it? We're still all right. About 15, 20 years ago, my mother and father came up here to Gainesville, and I took my father on rounds into a nursing home. And he, at that point in his life, was normal. And riding home, he got this incredible look, dagger eyes, and he looked at me and he said, Bobby, don't you dare ever let me get like some of those people that we saw. Don't you dare ever let that happen to me. So I said, well, Daddy, let's do this. I want you to think tonight about 5 things that have to be present so that you can define that life no longer has meaning. List 5 things that are simple, straightforward, that have to be present so that you can have no meaningful life remaining, and then you would be considered DNR. So the next morning he was working away and he scratched through this one and that one. And I've always gotten a real joy. The first thing on his list, when I can no longer laugh at a joke. And I've always remembered that when you lose your sense of humor, for a lot of people, life starts to have no meaning. And then, of course, the other things, when I can't recognize the people around me and when I no longer know really where I am or who I am, et cetera, et cetera. But always remember when I can no longer laugh at a joke. And then the third criteria that I use is when people become, let's just say, so old, so frail, that basically they don't necessarily have a terminal illness. They are still alert enough to know who they are. They still laugh at a joke, et cetera. But again, they're at a stage in their life when if they want to not be resuscitated, they have every right and privilege when you get to advanced age. Understand the hospital-based team. When doctors come in to see you in a hospital, ask them who they are. Are you the attending gastroenterologist? Are you the PA? Are you a second-year resident that's rotating on the service? Make sure you know and write it down because you can understand the pecking order. Let's just, some of these other things are self-explanatory. One other little thing that happened to me about, 2 or 3 months ago. A patient called the office and said, we were digging, the father had died about 6 months previously, had been in an assisted living facility for 3 or 4 years, et cetera, et cetera. And they were going through his papers and noticed that he had long-term care insurance, which they had not known about and were interested as to whether or not they could retroactively be reimbursed by the insurance company. And I had that happen a couple of times. In fact, in my own family, my wife's father was in assisted living, and it was only, and he had dementia, and it was only when family members started going through some of his papers, they noticed that he had an active long-term care insurance policy. And David, maybe you can answer part of this, but I don't think a long-term care insurance company is going to call you up periodically and say, do you want us to activate your long-term care insurance policy? That's not the way they operate. So as the advocate, keep up with what your mother and father do in regards to purchasing long-term care insurance and not telling anybody about it. I would think the fact that the premium notice keeps coming in is a notification unto itself, but just beware of that. So the bottom line in my talk today has to do really with the withdrawal of primary care, me, as you're not having as active a voice in navigating you as the patient through the hospital, of helping you understand things like you need to understand, because the primary care doctor has been, let's just say, pulled away. And I think it's up to my partners and myself and people just like me to make an effort to keep up with their patients in the hospital. You as the advocate can keep up by at least having some idea as to the information that we need. And what I would like for y'all to do is, everyone here has had, I am sure everybody in this room has been an advocate. It's something that you cannot avoid. And any ideas that you have in regards to experiences that you've had and what could be added to this. I just started handing this out in my office yesterday because I just over the weekend made up the form, and it's going to be modified. I will say this, that Susan, I see you and David sitting over there, and probably if I had to have a reflection on probably one of the more complex, one of the more enduring, one of the more heart-filled, one of the most successful hospital, multiple operations, recovery. This was following a motorcycle accident 10 or 12 years ago. Got back to working, to being recognized by his workforce as an outstanding individual, got back to playing golf, only to have another illness come along. But this was 10 or 12 years of incredibly complex, incredible participation of the whole family. And that was Michael Gracie. And David, you and Susan can be incredibly proud of yourselves for probably hanging in there and being advocates that nobody could have accomplished if you didn't have that intuition to do that. And so again, that's all I've got to say, and it may be time to close. If anybody has suggestions, ideas, questions, criticisms, what do you think? Had enough, I think.
Yeah, I would love it if we had time for questions. Dr. Slaton, can you hang out for a couple minutes? Is that okay? Great. Well, I wanted to take a quick minute. I had a lot more to say, and I was just going to kind of speak candidly here, but I'll just kind of sum it up by saying you've conveyed it so well. There's not much to say other than just my own personal perspective of Dr. Slaton, the evolution of managed care and everything he's been talking about. He is truly the authentic patient's physician. I'll just quickly say, Dr. Slaton, you're one of maybe one or two other folks in the Gainesville community have spoken to us, just kind of doing me a favor, and each of them I thanked for answering my call and doing this. And when I called Dr. Slaton, it was like at I don't know, it was probably like 8 a.m. I was earlier than that. I was trying to catch him before he started seeing patients. I think it was a Friday morning a bit ago, and answers the phone. I said, wow, I'm glad I caught you before patients. He said, actually, David, no patients today. I'm in Park City, Utah. So it wasn't almost 8, it was almost 6. That's the kind of doctor he is. It's not because he's a friend, it's because I'm his patient. I need to say this just quickly. Dr. Slaton was there for my dad and for my mom and for my sisters and me, not only through his hospitalization, but he was there when Dad was at the Haven Hospice, the E.T. York Haven Hospice Center up there on 39th Street, 39th Ave. Dr. Slaton was there. Dad was there for maybe 2 hours, just a little while, but Bobby was there holding my mom's hand, holding my sister's hand, holding my hand. So this guy's the real deal. So thank you, Dr. Slaton, for your time. I have a coin for you that has our 4-way test on it, but it's in my truck. I'll get it for you after this. The winning ticket number is 559. Folks, look forward to seeing everybody next Tuesday. Have a great week. Thank you all.